Second should be, if there are so many results, should be the sequence in which I need to present these results. And the third, the most important being how it should be presented. Because results can be presented in various forms. It depends on how you want to present, and that will attract the audience or the readers of the journal. So to start with, which are the results that need to be presented? As I said, that as a first author, you are the ones who are best to decide, right? And most importantly, it should be related to the primary objective or the primary outcome, and if required, the secondary outcome, and lot of other factors or other results that you would have done in order to analyze the correlation or covariates that could have affected the results. So primarily, those are the results that need to be presented. And the sequence of presentation is again, there is a standard format in which most of the journals use, starting with the flow of participants. As you start the result section, first we need to know how many participants from which this data was collected. So that should be the first results, followed by the demographic characteristics or any clinical characteristics of the study participants. Then the third will be the primary outcome variable results, then followed by the secondary outcome variables. And then if there are any other factors that influence these outcome variables in your study, so those results need to be presented. So that should be the sequence of presentation. I think that's quite pretty simple. I don't want to explain too much on that. But what is important is how it should be presented. Why I say this is because when you say results, the results can be presented minimally in three forms. One is the text, which most of you are familiar with. Then the tables, which is again very important in most of the journal sections. And then the figures, which many like to put their work in terms of figures. So these are the three common forms in which results can be presented in a clinical manuscript. So talking about text, the text is one thing that we try to avoid too much in the result section, because your entire manuscript is full of text. So text results is the only section where you can present your data in a different form. So as much as possible, try to reduce the text component in your result section. So only in situations where you want to provide certain qualitative information which cannot be provided in any other forms, you can use this text. And even then, you need to use text only to explain few of the variables and simple relationships. Once you find that the relationships are complex, okay, never use this text to explain in the result section. And whatever it is, please keep the text to minimum in the result section. You should see more of numbers and images rather than the text in the result section. A simple example of a result section, results with the text could be if you just wanted to say what is the number of patients that you used and what is the mean age, how many were males, something like that. So a simple explanation we can provide in the text, but not beyond this. But then comes the tables. The tables, as we know, is the most eye-catching components of a journal article. There are many readers who first see, after reading the abstract, they just go and see the tables to get a complete picture about your study results. Because this table makes the purpose of your study very clear even at a glance. But one thing you need to remember is you cannot put table for everything. You need right amount of information if you want to prepare a table for that particular data. If you find there are less than 2 or 3 data, then it is better not to go for table, but just explain with the help of text. For example, if you see a table like this, okay, so this just has one data, which is basically what is the sample size and then what is the mean age. So which doesn't require to be explained in the form of table. So this can be simply mentioned in the text itself. So most of the journal people will look for whether you are doing it purposefully or is it required for that particular article. So one such example is avoiding these kind of tables which is not necessary and could be explained by the text itself. So then when to use the table? It definitely it's not for any data which is less than 3 or 4. So in such cases, okay, where you have large data sets, so the best way to explain the data will be only the table section. And sometimes it could be a simple data, but there are a lot of relationships that you need to explain. Even in that situation, you can go for these kind of tables. And when you want the exact values, say for example, if you want to generally just qualitatively explain, you can use text, or even you can use some of the graphs to tell how the trend is or how the patients are behaving, something like that. But when you need exact values and very more quantitative information, the best way to represent that will be only in the form of tables. And always these tables will help to complement the information that you provide in the text. You explain in the result in the text way, but if you want to make it more clearer, you can supplement that with some of the table. So that's why tables. These are the some scenarios where you need to use the tables. So once you decide to use the table, you need to use it properly. Okay, so you need to understand what are the basic components of a table, not the wooden table what is shown here, but I'm telling about the table that we use in the Microsoft Word. So each of the table should have minimum of this first three and the fourth one if required. So definitely a table should have a title. It should have a column heading as well as row heading, and obviously the data, and then footnotes if required. So title, if you are giving, it should be very short, specific. At the same time, it should be descriptive to understand what this table is about. The column headings, what you give will, even if you don't tell, it will help the reader to compare the data between the two columns. So that's the advantage and the power of the column headings. I will show you with an example, then you will understand. Then you have the row headings. Row headings are needed to explain the multiple characteristics of the study participants. It could be the age, gender, or BMI, or any other clinical characteristics. So all that will come as row headings. And data, how do you put? The data can be in terms of words or in terms of numbers. Most commonly, it will be numbers. So when you're putting the data, you have to ensure that the numbers are always right aligned, and the words, if you're using in the table, that should be left aligned. So this is an example of a table. So you can say the table 1, you need to number and put the title of the table. So the column headings, given three column headings, head 1, 1, 2, and 3. And the row heading, as I said, could be the multiple characteristics of the participants or the study. And then if you see the alignment, wherever the words are used, that is more on the left-hand side, whereas when the numbers are used, that is more aligned to the right side of the column. So that is how you need to follow. And similarly, footnotes, when you are using, okay, you need to explain that what is that footnote. You can put the symbols and then try to explain what is that footnote. So this is a real table. You can see the table heading where it clearly says it talks about the demographic characteristics of the study participants or subjects. You can even add the sample size in the table heading. And the row headings are age, height, and weight. Your column headings are whether it's a control group or an experimental group. And you can see all those are numbers. So it is right aligned. And we have used footnotes for the units. Okay, that is centimeters and kilograms. So this is how a simple table should look like, and it should have all these headings. What are the things that you need to avoid in a table is most commonly people have multiple groups and they mention it as group A, group B, or group 1 and group 2. It is better you avoid these terms because when the reader sees a table, the reader may not understand whether group A is a control group or an experimental group or whatever group it is. It is always better you use directly what is that group. If it is a control group, you put as a control group, or if it is a particular treatment group, you can mention the name of the treatment, and hence that way you can identify the group in the table. And many people give proportion of males and females separately in a table, which is sometimes unnecessary. We know that if 70% are females, then we know that 30% are females, okay, males, unless otherwise you are using the other gender also. If you are using only males and females, it is very clear that the remaining portion of the subject will be the other gender. And sometimes we use lot of percentages and percentage of percentages. Example, you say that out of 40 participants, okay, 70% of the participants have, say, right ear pain, and of the 70%, 30% of those 70% has some other problem. So if you keep doing like this, it will confuse the reader, and they may sometimes stop reading that and close the journal and go. So it is always better, whenever you use percentage, use only the common denominator of 100. So that is what you should use, and everything should be based on that number and not the further descriptions inside that 100. And you should make the meaning of each item in the table very obvious. Okay, so people should not refer back to the journal inside to find out what they have mentioned in the table. So it should be very clear. As I said, it should give your entire results when just seeing the table without even referring to the text in the article. If you think that your the data or something what you're putting in the table, you cannot explain too much inside the table, then you can obviously use these footnotes. Footnotes, when you decide to use, you have to use only these symbols. Okay, you cannot use any symbol that you like. So the symbols should be either star, then the cross, double cross, the double dollars. Okay, I don't know the names of those other two, but this is how, these are the symbols that you should use when you are putting it in your manuscript. And if you have more than, say, now you have 6 symbols, if you have a 7th footnote, then you have to use double star, and then the 8th footnote will be double cross. Okay, something like that. But when you decide to use footnote, please keep footnotes to minimum per table, because otherwise it will become like a table of footnotes, which is of no use. Okay, there won't be any data, it will be only having footnotes. So that's why you try to use 3, not more than 3 or 4 footnotes in a given table. Sometimes we also wanted to add certain bit of text at the end of the table, okay, to make the purpose of the table clear, or even at the starting of the table, you can say that what this table is about. Sometimes you may not be able to explain more descriptively in the title of the table. So for that reason, you can always add a text before the table to say that what is the following table going to show. Example, you can either emphasize certain aspects or make an interpretation. Okay, you can see that if you want to say, you can always say table 1 shows that demographic characteristics of the study subjects are similar in both groups. So when you give this direction, then it will be easy for the reader to just see in that context. Yes, he or she will just see whether the groups are comparable. And once it is comparable, we know, yes, the table is doing what it's supposed to do. So if in case it is not possible for the reader to understand on his own, it is always better to give an additional information after the table or sometimes before the table to say that this is what I want you to see in this particular table. And how many tables we can use in an article? Okay, so there is always a limit for using the table or figures in a particular manuscript. So usually they have certain numbers like 5 or 6 maximum tables, including figures. Okay, for all the tables and figures, usually they combine and say not more than 5 or 6 per article. So you should know how to use these tables effectively if there are too many tables, you have to try combining some of the tables which have similar column headings. Like, for example, if you have one table explaining scores in a control group and another table saying about the scores in the experimental group, we know these tables can be combined. So we can use what is called as column subheadings to combine these two groups. So like this, so you can make the two major columns, which is control and experimental, and the sub columns will be your pre-treatment and post-treatment. So by this, the two tables can be converted into one table. So this is one way where you can do to limit the number of tables if you feel that there are more tables that you need to put it in a manuscript. And this is one common problem that most of the researchers face is the table is quite big that it will not fit into a single page. So it is always better to make sure your table fits in a single page. You cannot put a PTO for a table section. Okay, then the whole thing will get lost. So try to minimize your table so that it fits only in a single page. For that, you may reduce some of the font size in the text or the data. And also you can reduce a line spacing, even though they ask for a double line spacing in most of the journals. So you maybe for the table, you can reduce it to 1.5 in order to fit it in a single page. But as we are allowing you to reduce the font size, don't keep it so small that people cannot read. Okay, so you have to keep a minimum font size so that it is visible with the naked eye and need not zoom the article to see what is it. If you feel still it's not possible, you can divide the table into two. If it's a large table, you can divide and it's not fitting into one page. It's always better that you divide the table into two halves and present it as two separate tables. And this is one again thing, especially when you're doing systematic review and meta-analysis. Okay, you will see a lot of tables in the landscape version. Okay, it's generally as much as possible avoid it so that it is easy for the readers to read, especially in a soft copy. See, nowadays, nobody reads in the hard copy. In the hard copy, it is easy to rotate the journal and then read. But in a soft copy, when you're reading in a portrait, suddenly if it comes in a landscape, then people tend to rotate and every whole text gets rotated and they get confused and makes it irritating for the readers. So for that reason, it is always better to orient the table to portrait, but if it is unavoidable, yes, you can put it in landscape. And for that, when you're putting in landscape or portrait, whatever it is, make sure that there are no more than 10 columns in a table. Because if you add more than 10 columns, invariably it cannot fit it in the portrait. Okay, so you have to put in landscape only. And moreover, it will not give you the information that you wanted to convey. Too much of information in the column also will create trouble. There is nothing much, no problem in number of rows. But when the columns are more, the readers find it very difficult because, as I said, columns are basically for the readers to compare. So you cannot compare more than 10 in a table. So that's why it is better to limit the number of columns to 10. And we know that when we submit a table, okay, it goes to peer review, okay, along with the rest of the article. We have to be very clear, and most of the time it should be a blinded manuscript. So we need to ensure that we don't put any identifiers like author names or institution name in the table. By mistake, if you add that, then the journal can easily reject just because of you mentioning an identifier in the table. So be careful when you're preparing the table. Okay? There should not be any identifier. And if there are more tables, it is always better you number the tables properly and put it in the right sequence. So why the sequence is important is sometimes people will just see the tables to understand the entire manuscript. So if your tables are arranged in the nice way, that will give you a clear picture of what this entire study is about. So as I said, they will first see the flow of participant, then they see the demographic characteristics, then the primary objective and the secondary objective, and then the covariate analysis. So when they see that, they will know exactly what this study is about, what the study findings are about. So that's why the sequence is very, very important. So that's something about the table. So you need to ensure that you prepare the table in a way that it is easy for the readers to understand. Next, coming on to the figures. So figures are very useful in the manuscript if you want to explain a relationship among the variables. And how many relationships? Very few. Okay, you cannot explain too much of relationships. I told you, if it is too much of relationships, it is better to go with the table. But if it is few relationships and you want to mainly show the trend or pattern of your data, figures are the best way to show it. But as I told, figure can also show only few results. Too many results you cannot explain by the figure. You need to again shift your data to the table. If you have more results, then either you can add more figures or, as I said, move the data into either table or in the text form. Just like the table, we have to make sure that the figures will help the reader to understand your data better. So we need to use these figures in a proper way. For how do you do that? Is you make multiple mock versions, and you can ask the third person to interpret that. And if that person is able to interpret, that means you have done a good job, and that is the figure that you can use it. Now, again, figures, there are certain types. The common types of figures are either photographs that we use or the diagrams, we call it as flow diagrams, and then the most common one, which is being the graph. Photographs, as we know, they're very attractive. Very people wanted to publish their photographs in the journal, but it is very expensive to publish. So most of the journals will ask you money in order to publish the photographs that you wanted to show it in the manuscript. Once you decide that you want to put a photograph, make sure that it is very clear and of a very good quality, because you know that sometimes people read it with Xerox copies, and if you take 2 3 Xerox versions, then the figure will not be seen only if it is not of a good quality. Label relevant parts, because when you put a figure, you know that the readers will see the figure in different way. We don't know where the reader is seeing that photograph. So it is always better that you mention where you want the reader to see in that photograph. And also to give you the idea of what is the size of the object or the image that you have shown, it is always better to use a ruler and, as I said, arrowheads as well. So why? Because you nowadays people take photographs in the zoomed way, and we will not be able to imagine the size of the image or the object that you have put it as a photograph. I'll show you with an example. So if you see this particular, maybe you can call it as an animal or an insect, but you have no idea about what is the size of that, because it would have been taken in a more zoomed way. So it is better to use a ruler. So this indicates that yes, this is just a 3 centimeter insect. Okay, but it looks like a very big image, but it is only a 3 centimeter, 3 or 3.5 centimeter insect. And even here, if I ask you to see this image, each of you will be seeing at a different place. Some will be seeing the tail, some will be seeing the head, okay, or the sting or whatever it is. But it's the author who will decide where the reader has to see. So for that, you can use an arrowhead. So if you use an arrowhead, automatically all the readers will focus towards the arrow that you are showing. First, they see that, and then they see the other things. So this simple arrowheads will help the readers to locate where they are expected to see in that particular image. Okay. And if you are using human figures, it is always important to maintain the confidentiality. So how do you do that? Is one, you hide their face or the eyes. And if you are reproducing an image from another source, you have to acknowledge the source. Okay, example. So here you can see, okay, the identity is hidden by covering the eyes, and you are using an arrowhead to indicate where the person has to see. And if it is an image reproduced, you have to say that under the figure that it is reproduced from this particular journal. Okay, and you can quote that reference. This is what I said. You cannot zoom too much. Okay, we don't want it to see, and it will only confuse the people. And one more example of what is the problem in zooming. Okay, so when you show this, to imagine something, this common mistake happens. If you take, you won't realize that you are given an image, zoomed image, but they will interpret it in a different way. So that's about the photographs. Then coming on to the diagrams, most commonly used diagrams are the flow diagrams. These flow diagrams are very commonly used in method sections more compared to the result section. But nowadays, when for result section, we started using it. But earlier, it was used more in the method section. So in result section, we use it mainly to explain the flow of participants. When you wanted to say how many people were screened and how many participants were included, how many excluded, all those details, if you want to give, it is better to explain in the form of a flow diagram. Okay. When you are using those flow diagrams, you need to be more um, proper, that you have to ensure the boxes, arrows, and the fonts that you use should be of proper size. Each box should not be of a different size. That will all look make it look very messy, and the journal people may not like such shabby work. So you have to be very clear with that. And if required, you can always get a professional assistance to make those flow diagrams so that it will look neat and clean. So this is one example of a flow diagram. Okay, very commonly, as I said, used in explain the flow of participants. So make sure that the tables, arrows, all that are equal in shape. So it is easy for the reader to compare and understand what is his entire figure is about. This is one where flow diagram where you use it in the method section, okay, or in any other section other than the results also. So this is one of my article. Though I tried my level best, if you see again the boxes are not of uniform size. So there was a comment from the journal editor that you have to rework on these particular flow diagrams. So that's why it is always better to get a professional assistance if you are not able to do a good work. So that's about the flow diagrams and diagrams. This is the most important and the very commonly used result section is the graph. So now if you see, almost it became like a compulsion in manuscripts. Okay, there are many times that we flip the article to see whether there are any images and whether there are any graphs to understand better, because they are very attractive. Only problem is, again, graphs should be used only wisely when you have adequate amount of information. Okay, you need to have at least 4 data points to put a graph for that particular data. If you feel that the data is less, again, it is either better to explain by text or maybe with some other image, okay, but not with the figures. When you decide to use a graph, you know that when you use a graph, there is x-axis and y-axis. So the scale values need to be kept properly. Okay. So it's better always you start the scale values from 0 in both x-axis and y-axis so that the people will be able to understand it better. Okay. So use proper scale values. And if you think that whatever you put it inside the figures are not able to explain it clearly, you can always use certain legends to clarify what is inside your graph. Something like how we used footnotes in the table. Same way you can use certain legends in the figures to clarify what is there inside that particular figure. I will see some of the common graphs that we use in the manuscript. One is the pie chart. So basically, we use this to explain the demographic or the baseline proportions, like how many males and how many females. Okay, something like that. Or you explain some of the clinical characteristics of the participants. Okay, this is an example for a pie chart. But for some reason, it is always said that you avoid these pie charts in the clinical manuscript. Probably the reason could be you need multiple colors to clearly demarcate the proportion values. But somehow they don't like too many pie charts in a particular manuscript. Okay, maybe one or two maximum you can use. If possible, avoid that as well and try to explain with some other ways. Okay. Then comes the scatter plots. So scatter plots are very good type of graphs to explain the relationship between variables. So all the people who are doing correlational studies or relationship studies, you will have to use these scatter plots to explain those relationships. Okay, it's important to note that it is not that we have to use the scatter plots only when there is correlation or only when you find a statistical correlation. Even you can use these to explain that there is no correlation also. So that's the beauty of these scatter plots. So don't think that you need to use this only when you get a positive result. So when you decide to use these scatter plots, always remember your R value, what you get from the statistical analysis is more important than P value. For correlation analysis, it is always important to include the R value within the figure or maybe sometimes in the uh, heading of the figure rather than the P value. So many people I have seen they put the P value, which is of no use in a correlation study. Okay, more important is the R value. So this is an example of a scatter plot which shows there is a positive correlation between the two variables in the x and y axis. And you can always mention the R value as like 0.8. Okay, that gives that there is a good positive correlation. Similarly, when the diagram is like that, it is very clear that there is a negative correlation. So you don't have to explain anything. Just putting the graph, the reader will understand when one value increases, the other value decreases. So it shows that there is a negative correlation. And as I said before, it is not necessary that you should show only when there is a correlation. You can also show when you want to explain the result that there is no correlation between the two variables. It's a very good way of representing that the two data are independent to each other. One is not related to other. So certain things that way also you can use this scatter plots. Then you have the most commonly used bar graphs. Okay, people who use more than one group in their study always use bar graphs because we with that we can explain the results in terms of categories. The categories could be like a pre-treatment and post-treatment, or within the gender, or between two groups, that is control group and experimental group, etc. Okay, so we need to remember that bar chart is used, a simple bar chart is used only when you want to show the mean value. Okay, and if SD is also important, then you may have to use a different type of bar graph. Okay, like for example, this is a simple bar graph where it shows uh, two groups data with a pre-treatment data and a post-treatment data. So we are depicting that in terms of a bar. But here the value, the outcome, what is shown is only the mean value. Okay, but there could be standard deviation or the variations in each of this. If you want to explain that, then you use what is called as the error plots, right? So with this, you can always show that, okay, mean is also shown, standard deviation is also shown. Or if you are using a graph with the help of median, median and IQR can also be shown. So this will give the entire picture of how the data is varying within each of the group. And then the reader will be able to make an interpretation based on how it is different across the different groups. So before you decide a graph, try to make different versions of graph so that, again, as I said before, you ask the third person to read the graph and interpret the graph, whether he can understand, and then decide about the particular graph. Avoid multiple colors in the bars or the graphs that you are using. When you have 3 or 4 groups, if you use more different colors, it will look nice in a PowerPoint presentation. But in a journal, okay, generally they avoid or they ask us to avoid using these multiple colors because each of this may also attract cost. Okay, so in that section, what they do is they ask you to use colors like black, white, gray, or speckled gray colors. Okay, so something like that, which can be printed even in a black and white journal, right? I mean, the black and white article. So still we will be able to differentiate the groups. one of the reason why I showed you only those four colors is because you cannot keep more than four bars in a figure, because that will make it more confusing for the reader. Okay, for example, okay, if you show a bar graph like this, okay, I don't think anybody can understand what is the purpose of this. Okay, nobody can interpret this. So avoid using more than four or five bars in a particular diagram. And some people are very fascinated. You use different types of figures like three-dimensional graphs. Again, remember that in a clinical manuscripts, it is better to avoid these kind of 3D images. Okay, something like this. This may be good for a marketing study, okay, or people who are presenting like in MBA studies. Okay, that's okay because they will able to understand better. But as a clinical person, it is always better to avoid these kind of three-dimensional graphs. Okay, it is more than that, it is very confusing as well. And another important reason we need to know is just because we need to use graph, because there are certain, I have seen even certain guides tell that please use some graph in your study. Okay. But it's you who need to decide whether that graph is necessary or not. For example, okay, this is one graph which is actually published in an article, and the heading they gave is it's a graph which should not be there. Okay, so this is a graph which just shows what is the sample size in each of those four categories. Okay, so this need not be shown. Okay, just we wanted to show what is the number. So you can even simply explain by a text for this, and no need to make a graph or a figure just for the sake of adding a graph. Okay. And then the another graph, which is again we commonly use, is the line graph. They're very useful because this will help you to understand what happened to the participants over a period of time. People who are using maybe cohort studies, or people who use repeated measures ANOVA to find out what has happened to the data over a period of time. The line graphs are the best because this will help us to know what happened to the participants over the period of study. So like for example, if there are 4 days and each day you measure a particular variable, okay, this will show how the data varied across each days, right? But why it is important to know this is, okay, you can use 3 or 4 data points. So here, if I use 3 subjects, 3 participants, so it looks very neat. But if you use more than 3 or 4, that makes the data confusing. So that's why you should be beware about overcrowding the figure. So always, when you have more than 4 groups or 4 participants to explain in the line graph, use an additional figure. Okay, don't put it in the same figure. That will only create confusion to the reader. Okay, so that's what I have to say about some of the how you are supposed to present the results in your manuscript. I'll also give you some general instructions where because these are the common mistakes that I have noted in many of the manuscript when I review those articles. So people should not use mean and standard deviation values in a separate column, because there is no role or no advantage of mean without an SD, and no role of SD without a mean. So always keep mean and SD in the same column. And p-value, when you do statistical analysis, you may get 0, but you need to remember that there can't be a p-value of 0. So that's why when you get 0.00 something like that, so you use something like a less than 0.001 instead of saying p-value as 0.00. And some of the people try to hide this negative results. So remember that negative results are very important, because you are telling, if you got a negative result, you are telling the future generation that I've got negative, so please be careful about it. Okay, the negative, or don't waste your time in doing the same study again because it's going the other direction. So it's always useful to publish negative results. Okay, but many people they feel afraid that if I show this, then people will think that I didn't do the study properly. Okay, not like that. There are many journals who publish only negative results in order to make the people understand that the results can go either direction. Do not duplicate the results. Okay, what I mean here is many times what happens, you write the same result in the text, table as well as figure. because some of the, especially when you're doing thesis, okay, in the thesis book, it's okay that you explain in different forms, okay, so that the reviewer who is seeing will understand it better. But the journal article will not accept that. Okay, you should put your results only in one of the form. That's why it is becomes very important. You need to decide prior how you should present that result. Double check the arithmetic when you are using tables, and when you have so much of numbers, and when you are totaling it, make sure that the total is appropriate. Okay, so if you there is a total mistake, then the journal reviewer will think that you are too careless, okay, and not fit enough to be a have your article in this particular journal. So please check the arithmetic properly. And certain checklists that you need to have in mind. One, as I said, first decide what are the results that you're going to display in your manuscript. As I said, there are many results that you get, many data you will get. When you put data into the SPSS or Jamovi or our software, you are going to get a lot of information. But it is you who will decide what I should put in this particular manuscript. Don't put everything also. So you have to be very selective. And how it should be displayed is one of the toughest decision. It looks very simple when you see, but when you start doing your research and when you start presenting your results in the manuscript, you get a lot of confusion. Should I put it in text? Should I put it in table or graph? Which graph I should use? All that. So that you need to spend little bit of time to understand how each of these results need to be displayed. The sequence makes it important. I told you which should be the first result, then followed by which result, etc. And finally, what should be the result that need to be presented. In simple ways, I've told you, first start with the flow of participants, followed by demographic characteristics in the primary objective, secondary objective, and then the covariate analysis results. If you decide to keep text in the results, try to keep it minimum, because nobody likes text in the result section. And when you decide to use tables or graphs or other figures, make sure that you do a lot of mock versions. Make it check it with another person, and only when another person who is not connected to the study is able to understand that, then decide about using that particular table or a graph. As I said, ask a neutral person to look into it and interpret. Only if they can interpret correctly, that means you have done your table and graphs appropriately. Always give proper headings. Okay, sometimes I've seen headings like demographics. Okay, so those are not good headings. So heading should be short, that's fine, but it should be descriptive as well, with a table number and if possible sample size also. And sequentially number the tables, because as you know that when you are asked to submit the tables separately sometimes to the journal, and if you don't number the tables properly, then the tables may land up in some other place where it is not supposed to be. So it is always better you number the table. And the last and most important thing is, you should always keep this in mind. The text tables and graphs that you use in your manuscript should only complement and not duplicate. Many of the manuscripts are rejected because they tell same thing in all forms, and some people will go one step ahead and say even in discussion they mention those results. Okay, so journal, as you know, is a limited page business, right? So you need to convey your information, okay, as short as possible, at the same time more clearer. So don't repeat your results in different sections, right? Yeah, that concludes my presentation. I will be happy to answer any of your queries that you have related to results in this particular clinical manuscript. Yeah, thank you so much.
Thank you very much, sir. That was a wonderful presentation, and uh, I think sir has meticulously explained how to put in the results, because the results are the major part of our research. Though we conduct studies, if we are not able to put it up in a proper way in the writing, it affects a lot. Uh, so I request if any queries to put up in the chat box.
Okay. Yeah, there was one question whether it is preferable to write results and discussion section together or write individually. Right. So what I do is I give more importance to results first. So prepare the results table and all the graphs, everything. But when as I do the results, I will just make one interpretation about that result. I just write it down. That's all. But I won't explain that as a discussion. But it is always better you put the results first, make an interpretation of the result, and keep it there. After you finish the result section, take each result section. Like, for example, if you go with the demographic characteristics. So the first interpretation will be yes, they are comparable or something like that. But then you can think about the table, look into the table, and try to write more discussion points if you give some enough time for that. So it is always better finish the results and then start the discussion. It will be very good. I feel that you will get more points when you do like that.
Any other queries? I think I have some technical issues, so please look into the chat box, Dr. Pinki.
Yeah. So this is my question.
Yes.
That don't you think so? If we are writing the result and discussion separately, when I have started this thing of this manuscript writing, then this
Mm.
was my main query in the starting of my career. That when I find that there is some repetition in a result and discussion because explaining the result in a different section and a discussion in a different section, I find some repetitions. So how to
Yes.
avoid
Yeah.
it, sir?
That's definitely a challenge. Maybe
Yeah,
novice people will find it difficult initially, but
yeah,
as you write, you will understand. Because what happens is when you are doing presentations in maybe at the PG level or a UG level research project, they
yeah,
allow us to write results and discussion together. That means you put the result and discuss that. So
yes,
that's how we are used to. But in the manuscript, what they wanted in the different sections, right?
yeah,
So when you put the result, that's what I
mm,
said. You just have to interpret that. What is that result? And
mm,
next time in the discussion section, you should not repeat the results. Only you need to mention the interpretation of the result and then give reasons for it. So thereby you can avoid repeating the results, right? You cannot again tell that this is the value I got in the discussion section. You
mm,
just say that the results show there is an improvement in the experimental group
mm,
participants, example. Okay, but you don't give the value there. You don't
yeah,
say what is the result exactly, but only the interpretation. So that
yes,
is
yes, sir.
enough. Okay, and then you can give the reasons.
Yes, sir. Thank you very much, sir.
Yeah.
Yeah, it was really very insightful, sir. It was very nice presentation. Thank you, sir,
Yeah. Thank you
for
so much.
presenting
Yeah.
this. Yeah,
I'll be there for another 2 minutes if there are any
yeah, yeah.
questions.
Sweta, yes, sir. Yes, sir.
Yeah.
Yes, sir. Meanwhile, as we come to the end of the webinar, I would like to once again thank Dr. Manikandan Natarajan sir for accepting, in spite of his busy schedule and with the, I mean, as HOD administrative works, I know how it goes. So
Yeah,
thank you very much, sir, and thank you for enlightening us on results writing in clinical manuscripts.
Sure.
Uh, Thank you, sir. I would also
Thank you very much, Pinki. Yeah.
yes, sir. Thank
yes,
you.
thank you, sir.
Thanks, sir.
I would also like to thank Dr. Prakash Bhuminathan, President Isha, and Secretary Isha for their support and guidance. I would like to thank the entire editorial team of JISHA and the audience for participating. If you have any further questions, it can be addressed to chair.pub@ishaindia.org in. I'll put this in the chat box as well. So you can send your queries to this,
Yeah.
and then we'll communicate it to the resource persons and we'll get back.
Mm.
Right. Yeah. Thank you, Dr.
Thank you.
Pinki, and thank you, Shweta. Yeah. Have a
Thank
Thank
you.
you,
nice
sir.
day.
Thank you,
Thank
sir.
you.
Have a nice day, sir. Thank
Thank
you.
you, sir.
Have a nice day all.